Last Friday, the Norwegian government abruptly announced that beginning the very next day, all COVID restrictions would end. No vaccine mandates, no vaccine passports, no masks, full capacity at every venue, large concerts, parties, sporting events, you name it. Normal life would resume. Prime Minister Erna Solberg warned, quote, even though everyday life is now back to normal for most people, the pandemic is not over. People will still get sick, and therefore it is important that everyone gets vaccinated. The country currently has 67% of its population fully vaccinated. However, despite the high rates, this month the country also saw its largest spike in COVID cases, which it is now finally coming down from. The reason for lifting all of the restrictions isn't what you would expect. The Norwegian government didn't cite high vaccination rates or even having the virus under control as justification for returning to life as normal. Instead, the prime minister said the lifting of restrictions is due to fatigue in the public of constantly changing restrictions and the lack of normalcy in their daily lives. She cautioned that the virus is still with the world, so take personal responsibility. Singapore has also announced it will be living with COVID. The country has 82% of its population fully vaccinated with Pfizer and Moderna nearly exclusively. Despite the extremely high rate, Singapore is in the middle of its largest wave ever in cases, hospitalizations, and deaths. One thing to note is that neither the government of Norway nor Singapore even mention the unvaccinated. They do not place blame on the people who have not chosen to get the vaccines. In Norway, the prime minister urged people, especially minority communities, to get vaccinated, but never demonized them nor blamed them for their latest surge in cases or inability to eradicate the virus. There are no passports or mandates in either country, people living as equals regardless of their medical status. They urge people to get vaccinated, but beyond that, there are no checks or restrictions on those who haven't. Singapore is anticipating larger spikes than what they have now, but the reason they are letting it circulate is because they know there is no getting rid of the virus. They've come to terms with that fact and have moved on, focusing on hospitalizations and death rates. None of these countries are panicking about their unvaccinated children. These countries are ahead of us in vaccination rates with the same vaccines we use here in this country. And yet in these nations, just like in Israel, massive spread still happens. This shows us that unfortunately, there doesn't seem to be a magical herd immunity threshold we can hit that will stop the spread. Perhaps the metric we should focus on is hospitalizations and deaths. We know the groups who are most at risk of severe outcomes. That hasn't really changed despite the new variants. The elderly, people with hypertension or diabetes, and people with a BMI over 35, amongst other risk factors. One thing seems certain. With increasing mandates and the constant dehumanizing of the unvaccinated, we are tearing away at the fabric of our free nation while furthering the divide between us. And in the end, the virus will still be here. Vaccination, they're 82% fully vaccinated, a little bit higher if you count. They don't count their the people, the 5% of them that got the Chinese vaccine. But if you do count them, then, they're getting up to 90%. Yeah. One thing to also point out is that in Singapore, when there was ever a discussion about mandating the vaccine, they specifically talk about it for people 60 and over. So they know the risk groups. And they're saying, well, if we're going to mandate it, it should be for the older people because they're the ones that are in the hospital.